Good evening, everyone. For those of you on the East Coast, oh my gosh, West Coast is still enjoying the afternoon. We'll just give another minute for people to join and then we'll get started. Alex, which coast are you on?
I'm on the East Coast also. I'm in
Where?
Philadelphia.
Oh, nice. Okay.
Yeah.
Fantastic. Okay, I know we're always short of time, so I'm going to go ahead and get started, and then hopefully um, we'll have the recording for people in case they miss something important at the beginning. Good evening to everyone who is joining us for our Starling webinar series designed to give you, healthcare providers across specialties, pearls to help you feel more confident in supporting your patients with mood and anxiety disorders across the reproductive lifespan. I'm Dr. Nazanin Homaifar, and I'm a board-certified OB-GYN practicing in Northern Virginia and the medical director at Starling. Starling is a virtual mental health clinic that treats those experiencing anxiety, depression, and trauma throughout fertility challenges, pregnancy loss and miscarriage, abortion, and postpartum. And I'm thrilled to be here with our partners at Origin, the national leader in pelvic floor and women's health physical therapy. Together, we're working together to bring whole person care to more women across the country. And I could not be more happy to have Dr. Alexandra Bertucci. She has a lot of abbreviations behind her name. Um, Quite a few. One day I'll ask you about all of them, but I think they all speak to your expertise. Dr. Bertucci is a doctor of physical therapy with a board certification in women's and pelvic health, as well as certification in sex counseling through Aztec and PRPC certified through Herman and Wallace. She has specialized in pelvic floor therapy since 2018, recognizing a gap in care connecting physical therapy to the psychosocial aspects of sexual health. She obtained her sex counseling certification to provide comprehensive treatment for patients experiencing sexual dysfunction and pain. And as a former collegiate athlete, she also specializes in helping postpartum patients safely return to exercise and fitness. Alex provides both physical therapy and sex coaching services virtually at Origin, offering integrated and accessible care for women's pelvic health concerns. I mean, wow. It's not often you get to see a pelvic floor physical therapist and a sex therapist at the same time.
Yeah, I mean I got to the sex counseling certification through physical therapy, just being in pelvic and women's health for so long and you see it so much. So I felt like it was a really big gap, and it's really cool to, you know, all the training that we do as PTs is mostly with other PTs, and that training I got to do
Yeah.
with a lot of mental health professionals. So it was really cool to just learn how we are treating the same patients, but like really look at things differently.
Absolutely. And I can't wait for our discussion today. I am simultaneously manning the weight room and also trying to keep us on agenda. So if you hear me pause every now and then, please understand that's why. But today we're going to talk about the pelvic floor, how physical and mental health intersect. This is something that I talk about every day in my practice, and some practice pearls we hope people can take back to whatever kind of clinical practice they have. We'll also close with a short Q&A, so feel free to keep your questions or drop them in the chat and we'll answer them at the end. Alex, let's start with the basics. Let's hypothetically, for providers who may not closely work with pelvic floor PTs, can you give us a quick overview of what the pelvic floor is, what all entails the pelvic floor, and why it matters to pregnancy and postpartum?
Yeah, for sure. So I'll use my little model here. But
Let's
so
see.
the
You have
pelvic
a
floor
model.
muscles, yes, I have it
Just
always
lift
handy.
it closer because of
Yeah.
the blur in the background.
Okay.
Yeah,
Yeah.
perfect.
Okay. So the pelvic floor muscles collectively are the group of muscles that attach from the pubic bone to the tailbone at the base of the pelvis. Um, we're
And
kind of
everyone
looking at
can
the,
feel their pubic bone. You can, like, if
yes.
you go right where your bladder is and press, you'll be able to feel your pubic bone.
Yeah. And these muscles again, kind of some of their functions, you know, for everyone are support of our organs, support for sexual function, and just generally support of the whole pelvic structure kind of from below. So that's kind of that core muscle function of the pelvic floor, which I feel like a lot of people don't realize just even from an exercise standpoint. But in pregnancy and postpartum, we have this huge shift of what the pelvic floor is doing just purely from a support standpoint. The uterus is getting bigger. So the pelvic floor is working hard to support all of those same functions, but now with this added weight during pregnancy.
Mhm.
In addition to the changes just in posture and the pelvic structure and how it works with the rest of the body. So that also makes the pelvic floor muscles work harder during pregnancy. And then postpartum, it's kind of this huge shift, like overnight, right? So just kind of shifting back into that state, not necessarily normal, but trying to now function after working so hard to support the massive change that's happening during pregnancy. So we just see this really big kind of shift back to, the body just trying to adapt back to some normal function after or during the postpartum time.
Yeah, absolutely. And I know we'll get into this with the next question, but like, what do these shifts and changes then result in? So, what kind of conditions do you most commonly treat in this population?
So I would say in pregnancy, it's most commonly pain related conditions. And for a lot of the time, this is a musculoskeletal type of pain. Again, just the relationship between the pelvic floor and the pelvic bones and all of that shifting that's happening during pregnancy. There's also the influence of the hormones that increase laxity and just the movement of this inherently very stable pelvic structure.
Mhm.
So during postpartum, research tells us that stress urinary incontinence is by far a very, very common thing that happens to a lot of women postpartum. And I think it's probably been studied the most because it is the most common. But we also see a lot of pain conditions postpartum too. Pain with sex is so common.
Yeah,
Once people are returning to that. Also, back and just generalized back and pelvic pain is very common
exactly.
postpartum as well. I would say those are probably the big ones, but that's not limited. It could be anything from constipation, even neck and shoulder pain. Um, Again, any type of pelvic pain or prolapse type symptoms.
I think, and today we really are focused on prenatal and postpartum. There's so many. I make at least 5 referrals to pelvic floor physical therapy daily for people at all stages of their life, but a lot of times too, we'll see, especially if I have my pregnant patients who've recently had a respiratory illness, have had a lot of coughing, that triggers the stress urinary incontinence because you have so much pressure on the pelvic floor, more weight on that pelvic floor than someone as ever has had. And so every time they cough or sneeze, they're starting to get some incontinence. So I also think, like, even in pregnancy, there's a role for it aside from the pain related and the laxity related conditions that affect the joints and the pelvic bone.
Totally. And a lot of times, one of my questions that I ask someone who's coming postpartum with incontinence is I'm like, did this start when you were pregnant? And a lot of the times they say yes.
Yeah, absolutely. And the other thing I was going to mention too, you mentioned pain. I mean, I think depending on the type of delivery someone had, whether or not they received assistance, whether or not the type of tear they had, or just generally anxiety, I think about. So I tend to refer to pelvic floor just to teach breathing exercises too, and reminding people how to kind of train, help themselves calm down in the pelvic area. And I'm glad you mentioned the constipation because I think people don't realize how much they'll kind of flippantly say, "Oh yeah, I always have constipation," and I have to remind them that can lead to pelvic floor pain that can affect their sexual health later on if it's not addressed either.
Yeah,
So
absolutely.
we now talking about the impacts potentially outside of just the physical, what is the intersection of physical recovery and mental health, which is central to both of our missions? Like, what do you see? How do you see pelvic floor disorders, things like pain, incontinence, and prolapse impact mental health?
Yeah, and I think you used a great example, so I'll kind of go off of that example. But let's say I see someone and they had like a very traumatic birth. Maybe it was just didn't go how they thought it was going to go, or there was lots of interventions and there was lots of physical trauma as well. So that is, you really see that in the patients when they're telling you their story and they're telling you about their symptoms. And I do feel like just starting off, I'm like, I'm going to need to give this person just more time because this is impacting them so much, and just like how they are feeling mentally is going to carry over into kind of the progress, and I think truthfully the speed of the progress that they can make, you know what I mean?
Mhm.
So, and again, we know, like, I know a lot of research from the sexual health world, kind of just from the additional certifications that I've done, but people who have not satisfying sex lives or like dissatisfaction with their sexual health also have poor mental health outcomes. And I think that's this, we see that in the chronic pain research too. So there is this definitive link between pain and mental health.
Mhm.
The greater the pain is and the greater that the disability or like the struggle is with whatever they're going through, that's going to come through in their mental health, and vice versa.
Absolutely. No, I think it's not something we commonly link, but when we are seeing patients with these conditions, it's very apparent early on. And I hope to, for our providers who might not be in women's health specifically, but might see these patients in primary care or other fields, that they can be attuned to that as well. I mean, we've kind of touched on this, but how does anxiety, depression, or trauma show up in your clinic?
And I think it's a similar example, right? A postpartum patient, and maybe you're talking to them, and maybe they don't, everyone sees this word trauma and they're like, well, I didn't have this like one traumatic event, but maybe they had a really difficult pregnancy. And while that wasn't like birth, it wasn't birth, this specific event was traumatic, but then kind of as they're recovering, they're like, it's taking me so long to recover. I don't understand why. And you kind of help them to see that, like, you're coming off of this huge, like, number one, just like tidal wave of hormonal fluctuations from being pregnant and giving birth. But this was a really difficult time for you. And then you're postpartum and you have all these other things that you're working on. And now your physical health, which is maybe not something that was ever challenging for you, like until you
Mhm.
were pregnant, is
Mhm.
now like at the forefront of things. And you're like, this
Mhm.
is, you sometimes I feel like we help patients to understand
Make the
how
connection.
they're like it going in the other direction,
Yeah.
right? And I see this all the time. It could be in a postpartum patient, but again, just in like the pain with sex, vaginismus, like the sexual health population, is people
Yeah.
don't realize that years of pain with sex has also been traumatic.
Right, right. I think it's so true that kind of pointing things out, and I think as a society, we yeah, we understand these things are going to happen. People will want to get pregnant. People will go through a pregnancy, have deliveries. We know that they can go all sorts of ways, but we've also not, we don't necessarily give people the space to explore the profound changes in our bodies that we go through. Like, yes, pregnancy is something we've done for hundreds of thousands of years, but and yet it is continues to be an extreme physical test, an extreme mental challenge. And whereas we might have had better levers of support in the past, we don't. And we just have to kind of put our head down and go through it. And so having that moment where you can reflect and acknowledge how important, how much someone has gone through can help them have an aha. moment.
Yeah, I was just gonna say, I do feel like sometimes when it kind of works this way, like when someone's coming in and they're like, I had a traumatic birth, I know that. It's like, okay, we know that this is the physical is connected. It's gonna take a little bit longer time. PTs, I feel like, can recognize that, but it's
Yeah.
almost like when it comes in the reverse, like when
Yeah.
you're kind of helping someone to, and you're getting to know them too. So you're kind of uncovering it yourself as a
Hmm.
provider. I feel like they do kind of get to this aha moment. And they're like, you know what? You're right. Like this is
Yeah.
all connected.
Yeah, absolutely. I think, you know, I see this a lot. I'm sure you do too. Body image is such a powerful theme in the postpartum period. Um, how does it how does it influence recovery and willingness to seek care? And what kind of advice do you give patients?
Yeah, and I'll use that example. And I think this is so common, specifically in my patients who have pain with sex and who are also postpartum. So,
Mhm.
pain is obviously a barrier to sex when there's like from start to finish. When I see someone who has pain with sex, I'm like, all these physiologic things happen, lubrication, vaginal
Mhm.
lengthening, all these things happen when you want to have sex. And if there's pain, that's like an immediate
Shut
barrier.
down. Yeah.
Yep. Or nothing. So the but there's also, again, for these postpartum patients, this mental load too of like
Mhm.
they don't, they're cleared for sex and that's great. And they're, maybe they're even looking forward to getting back to it with their partner. And then things just, again, we start here with a little bit of pain. And then it's like, well, this isn't working. I'm dealing with so many other difficult things in my life, baby stuff. I'm sleep deprived. I'm thinking about going back to work. And then, just my relationship with my body is different. My
Yeah.
relationship with my partner as like a sexual person is now different because we got a
Mhm.
baby in our room and it's not just easy to do it the way we used to do.
Yeah.
Um, so I think that I see that a lot. Like they just view themselves differently. And I think from a physical body image and just like I'm a person who can be sexual body image.
Yeah.
Um, so I think that not like, PT obviously can help address the pain aspect. But I think that just, again, a holistic experience for the patient. They're exercising, they're feeling better about themselves, they're getting the mental health support that they need, having these conversations with their partner that they probably haven't ever had to have before. So all
Mhm.
of that it definitely shows up. And I think it's really hard for people.
How do you tell them? Because I have this conversation a lot too, where I mean, there's a million and one reasons why someone might not feel sexual postpartum, right? You mentioned, and I think we discount the deprivation. I certainly see that in my perimenopausal and menopausal stage
Yeah.
patients. Libido is so complex. And yet, this notion of how someone feels, the confidence they feel, and the way they bring it into the bedroom can deeply affect how they operate in that space. And so, is there anything you tell them to talk about with their partner or anything that you tell them to reflect on so that they can tap into that and remember?
Yeah, this is kind of my like sex counseling 101 for my postpartum
Yeah,
patients. But I tell them the same thing. I'm like, libido is in part hormonal. Like we know that. And your hormone, again,
yeah,
a million and one reasons postpartum why libido could be different. If there are barriers, like we need to figure out ways to not just remove them, but like set yourself up for success. You know what I
hmm,
mean? Um, if you like, I tell this is like the best advice that I give every postpartum patient going like with who's having pain with sex. I'm like, you need to like 2 days in advance, more than that, probably 7 days in advance. Put it on the calendar. Be like,
yeah.
this is
Timed sex, timed
this,
intercourse.
yes. Plan it out
Yeah,
because you never know when you're going to get a good night's sleep. You may be
yeah,
exhausted, but if you put it on the calendar and you're making that time and space for it and it's important to you, it allows you to do some things to prepare.
yeah,
Like maybe you take off your nursing bra and you put on something that maybe makes you feel a little bit more like a sexual person and less like
Yeah.
you're feeding a baby all the
Yeah.
time. So I think that's a really simple thing. Again, so you can prepare, maybe you can like wash your hair. Like maybe that makes you feel really sexy. And
Yeah.
we don't get to do that a lot postpartum.
Right.
So
Right. I think that's great. I think remembering the things that help you feel confident, that help you feel, like you said, a little bit more sexual or sexy, even if it's one thing. And having I talk about timed sex all the time with people to help reduce the stress of, on one hand, one partner feeling like, am I going to get rejected? Am I going to get rejected? But knowing that this is the day. And on the other hand, the person who's been doing the rejecting or maybe not feeling up for sex being, knowing, this is my day. I don't have to worry about it any other time, but this is the day where I'm going to do the things to help myself, you know, participate. Uh,
absolutely. And like it can affect their relationships too. When that cycle goes on, it's like the rejecting partner feels like almost a like non-receptive to touch after because they're so afraid of what it could turn into. And then if there's pain
I've
present,
never
it's
thought
just
about it that way. Okay. That's so important, and especially because for some people, touch and just hugging, cuddling, those kinds of things are something that they want. But if they're constantly feeling like, if I do this, my partner's going to think more of me,
yeah,
that's going to be, then you're going to break that one thing that they enjoy.
right.
I feel like we could get on the sexual health
Yes,
stuff
I know.
and then let's go back to the let's make this concrete. I have yet to make my appointment to see a pelvic floor physical therapist. I have wanted to, I just haven't had the time. But what does it actually look like? I tell patients what I think it's going to look like, but what does it actually look like when a patient comes to see you?
So I would say visit one regardless of if I'm a virtual PT, so I'll reference virtual PT like as we talk about
Yeah.
this, but regardless of whether you're going in person or virtually, the first visit is a thorough subjective history taking. So we go through bladder symptoms, depending on what they're coming for, but we'll go through bladder symptoms, bowel symptoms, pregnancy history, any gyne history,
Okay.
any concerns with sexual function. I usually do a little bit of like an MSK low back screen.
MSK, just I think
Oh,
everyone knows.
sorry,
Yeah.
musculoskeletal.
Yeah.
Yeah. Um, just for pain function, we see a lot of low back and kind of hip dysfunction in those postpartum patients. So, um, and then just some social things, like we'll talk to them about their job and, are they a stay-at-home mom? Are they a working mom? What's your support system like at home? So it's a lot of talking. And then, again, I feel like virtually I do a little bit of pelvic floor screening. And what I mean by that is I just want to get an idea of how well connected they feel to using their pelvic floor and
Hmm.
what sensation they have of that. That's
Okay.
usually all that I have time for on the first visit. Maybe we go through, I usually start with a few breathing exercises too, but
Okay.
I feel like the history is more thorough than people realize it is.
Okay. So it's really about that information gathering and getting a sense of who this person is and maybe giving them some breathing exercises. Are you coming up with the plan for them at the future visit? I mean, I know it's not a one size fits all, but like, are you getting a sense and giving them a sense of what to expect in the next few sessions, or are you waiting until that next session to start that?
Yeah. And maybe this can kind of answer some questions about virtual care, but so I was a PT in person before I did virtual care, right? And so all of the other virtual PTs at Origin. So we all have like tons of experience. So normally by the time we hear a subjective, we have a pretty good idea of what direction we're going to roughly go in with this patient.
Hmm.
So I kind of have a sense of that, when we do our subjective history taking after I get a sense of what my patient can do or not do with their pelvic floor, I have them do a little homework, and that's kind of like self-assessing their pelvic floor using a
Got
hand mirror, using a finger if they're comfortable. So then
it.
they kind of come back to me already with some more information that I wanted to get. So that could be like visit 1 through 3, 4, even just depending on what they get to.
Got it. And so I love, I mean, I think virtual care has really made us realize that our patients are super capable of collecting this information and giving it to us. What, like, when would you recommend in-person care for someone?
So, and I talk to new virtual PTs about this too. I feel like that your typical patient who selects virtual, like if you told 10 people virtual care and like 5 of them were like, yes, this is for me, there's usually going to be a reason why. It's either
Hmm.
like they can't get out of the house.
Hmm.
There's like a, we take insurance. So maybe who is close to them, the in-person provider who is close to them only doesn't accept insurance.
Hmm.
I feel like the people who want to make virtual care work really want to make it work. You know what I
Yeah,
mean? And generally they do a great job with these self-exam techniques and things
yeah,
like that. Ultimately, like if we, again, because all of the virtual therapists have so much experience, if I see someone with just like a lot of things going on and it just seems like there may need to be like multiple different looks at this from it's typically they have a lot of musculoskeletal things going on and they have a lot of pelvic pain. And I don't know if they would be confident doing some of these self-assessment
your
techniques.
endometriosis, pelvic pain for multiple years, I imagine.
Yeah, like
And
it's
it's,
funny you say endometriosis because we actually see a lot of people I see a lot of people with endo because they've been to pelvic floor PT in person
and they need
before.
a refresher.
Yeah, they come back for a
Okay.
little refresher. But
Yeah,
yes, like
first time, but I would say like first time
yes.
or early
Yeah, yeah, yeah. Like
diagnosis.
really severe chronic pelvic pain. Again,
Yeah.
we do occasionally get those patients because like going back more to the trauma, I've seen lots of transgender patients virtually because they've been like not comfortable going into a visit. So that's kind of a separate thing. I feel like unique to maybe that
Yeah,
population, but or anyone who's experienced trauma. But yes, if we're seeing it and we're like, I really think that it's probably better suited that you go in person. Like we're all have a lot of experience with both in person and virtual PT that we can recognize that.
that's great. And so when you are working with an OB/GYN or mental health providers, like what would be your ideal scenario about how you would collaborate with them and how do you receive referrals at origin?
So we have an online HIPAA compliant form. I think we have a link
Okay.
something that we can provide to you. We also have,
Mhm.
just kind of like the referral paper script.
Okay.
And I mean, we get faxes from multiple different offices. So you just fill that out and all the information should be on there and it's faxed over.
Great. I think
I really like, oh, perfect. Thank you. Um, and then, for anyone, I'm always open to like direct communication. I know that's hard when all of us are working clinical schedules and things like that. But if there was ever a need, like, I share my email with doctors and even my phone number if that.
Flying by Food Lion in 10 minutes, period. Shall I stop for ice
let me
cream?
just make
Question mark.
sure everyone is muted. I know people are trying to get a lot listening and doing.
Yeah.
Uh, there we go. Um, and so, and do you ever send your assessments to the referring provider?
Oh, yes. So like our EMR system is integrated with our faxes. So when we write up our documentation, we can fax it over as long as we have the referring provider's
Right.
information. So we'll typically send over the eval and then we do a progress note every about 2 months. So we'll send
Okay.
those over as well.
And I was just reading through some of my patients' PT progress notes and just
Yes.
really amazed by the progress they had made. So that's awesome that we can get that feedback. I think that's one, I work in a big health system. I like that I can see when I make referrals, I can
Right.
read the note. And so I think it's really great that you found a way to integrate into into scenarios where that might not be happening
Yeah.
as easily. I want to know, what are some of your favorite products you recommend for pregnancy and postpartum patients? Please tell us.
Yes. So my probably I can personally endorse it. I've used it in both of my pregnancies.
Okay.
My favorite support belt is the Sorolla belt. It's
Oh, you have to. I just tell people to go on Amazon.
oh yeah. I
Love
and
it.
I do for certain things. This is something that I do kind of
Wow.
say it's worth the money.
I've never
This is
seen
the
this
brand.
one. Yeah,
It's
I
great.
found it and I will put it in the chat. Why do you
Okay.
like it so much?
So there are belly bands in
Yeah.
pregnancy, and I'm a little less specific with the ones that I like of those. I feel like they're a
Okay.
little more general. They're supposed to support the belly. So I find especially later in pregnancy, it's just nice to give a little bit of support to like hold your belly up.
Do you find any difference between the ones that have the band or over your
Oh,
belly versus just under?
I think that I personally find the ones that go up above your belly, like I think it kind of depends on the person's body type. Like if they're
Okay.
taller, I've heard that that upper part can kind of rub.
Okay.
Um, but I think that I I if someone really wanted that type, I would say, yeah, sure, try it out. The Sorolla belt is really for like that true pelvic girdle pain, like SI joint or pubic bone. Um, it's like a thicker material and it sits low, like around your pelvis here.
Right. Yeah, it's much thinner than what I would have
Yes.
ever, I think I would have never thought to recommend it. Okay.
Yeah. And
And
that,
it's
like, the, you know, this, like, the key takeaway phrase is if they're having trouble rolling over in bed, like, that's an not necessarily automatic, but like, you can be pretty confident that they're having that type of pain.
fast. Okay. Great. And then this is one, would you tell them to sleep in it or just,
I generally tell them unless they're you have to spend an hour a day out of it. So
okay.
most people, it just makes sense to not sleep in it. If they're like getting woken up out of like because of pain so bad, I'll be like, you can sleep in it. It's going to shift around a little bit. Obviously, it will
Yeah.
do that during the day too. But just when you're, some time of day where you're not going to have as much pain, try and take it off.
Tell me more. What else do you recommend? I'm like, I thought I was going to know at least most of them, but
Yeah.
I need more.
So one of my favorite postpartum products is actually the pelvic wand. Um, so this
Okay.
is, and I utilize this a lot because I'm a virtual therapist. So I'm teaching people how to use this to kind of self-release their own muscles. So
Okay.
I actually have them get it during pregnancy because they can do perineal massage with this end.
Oh.
So they do their
And this is,
perineal
what is
massage.
this called? This is,
This
this
is
is,
called this is the Intimate Rose pelvic wand.
okay. Intimate Rose Pelvic Wand. Okay. Tell us
So
and keep.
they hold it up here. It's a little bit higher for when they're pregnant, so they have a little bit more reach. And then you're using just shallow, a little bit of insertion. They don't need too much, but just to get more of the perineal massage. And then, say they're postpartum and they have some pain with sex, and maybe there's some tension deeper in the muscles. This is actually made so that when you insert it, it can like easily curve around the pelvis to get
Ooh,
those deeper muscles.
very cool. And then I'm on the website. They have a bendable, they
Yes.
have a vibration.
They
Do you
have
think,
many different types.
do you stick to the original?
I typically do, yes. If someone has a lot of pain, I will say, the vibrating one is nice because it can kind of just like, you know, you can get it to that tender spot and then just turn the vibration on, and that can kind of help to vibration is a really calming sensation to the nervous system. So
Okay. Oh, this is great. And then, would you be able to use the pelvic wand to do Kegels more effectively, or do you need something?
yeah, that's a great question. Like if I could pick one tool, I still would probably pick this because something that even people who don't have muscle tightness, um, they like I will have people just insert this either end and just feel themselves doing a Kegel. It's so much easier to do a Kegel when you have something to like squeeze against
Got it.
than just sitting there and doing it.
Yeah, amazing. And I know Mackenzie has dropped kind of some of Origin's favorite products. Last thing, lube and vibrators. Which one?
Yes. So silicone based lubricant, Uber Lube, like up and
I
down.
love Uber Lube.
I went to a conference a couple years ago and they were like, use it for your under eyes, use it for here, and like it works. Let me tell you. So not only is it a great lube, but it also is multi-purpose.
Great
Um,
to know.
with when we're recommending silicone products, we have to recommend a water-based lube because you can't use a silicone lube with a silicone product.
Mhm.
So I like Good Clean Love, just water-based.
Okay,
Kind of the pelvic floor PT, like in-person gold standard lube is called Slippery Stuff.
that's okay.
Um, I don't know if I have I like that one as well. Um,
Okay.
and then for vibrators, I usually say, unless someone's looking for something specific, simple and versatile. So there is, I recommend the O Nut to a lot of patients.
Oh yeah, but
And those,
that's not going to be used as a vibrator though, right?
well,
The
they have a one
vibrating
ring that
band.
you can buy with a vibrating piece on top.
Oh, okay.
So that
I
again, if you
mhm.
need kind of the pain component too, but you also want to add in some of that vibration. Um, but there's a brand called Maud, and I like just the very simple, like it's that very simple shape. Again, you can use it directly on the clitoris. You can use it up around the pubic bone because we know there's a lot of attachment of the clitoral tissue up even kind of through the pubic bone. Um, Unfortunately, the clitoris was only anatomically mapped like
A
5 or 6 years ago,
Yes.
but we know this now, so here we are. So you can really stimulate, and a lot of, again, women with pain do really well with stimulation in that area, kind of like that
Under the
indirect,
pubic bone.
deeper, even like right on top. So um,
Show us.
like if this is your clitoris,
Uh-huh.
like they do really well with stimulation, like here,
Okay.
like
External stimulation.
external. Yep.
Yeah.
Mm-hmm.
Okay. Okay. Helpful to know. Amazing. Um, I had a question about something, one of the products. ONUT, I was just curious how you tell patients to use the ONUT. Do you get your postpartum patients to use it?
I feel like a lot of postpartum patients have more of that superficial pain, potentially related to like any perineal tearing. But if they did have deeper pain, it's not uncommon to have that. I think it helps them to like build confidence a little bit too. It limits the O nut is like these silicone stacking rings that they would put on their partner or on a dilator or whatever. But it just limits the depth of penetration. So I do feel like that kind of helps them. Again, going back to that, just like mental load component,
Mhm.
helps them to kind of feel a little bit more at ease, and then they can take them off or not use them, as things improve.
Amazing. That's good to know. This was really helpful for me.
Oh, good.
Yeah, if you could leave OB-GYNs with one or two pearls that they can tell their patients tomorrow, what would that be?
I feel like you can probably always learn something at pelvic floor PT. You know what I mean? I think that just in general, with all the awareness there is about women's health and all the access that's increasing, which is great. We can treat mild issues before they become a problem, even if it's just like, for some people it's just learning about bladder habits. That
Yeah.
can really help them later down the line, especially as women go through all of these changes in reproductive years and in perimenopause. So I think that's probably my biggest thing is I think there's always something that, everyone can kind of take away from pelvic floor PT. And I think that, know that we are also like we do a lot of screening and, we're trained specifically in pelvic floor, which is an understanding of kind of what you guys do too. So we really understand that collaborative aspect and we like are the biggest fans of you guys. Like we want like everyone to have all the things that they need from OB-GYN. So we can kind of work as a team and get the patients, the holistic care that they need.
I think that's so true. And I think it's just a reminder to any of our providers, and probably our providers who are listening already know this. It's the ones that aren't. But I think that's so important. I think in Western medicine, we think a lot of once something has become a problem, treating it, but looking at pelvic floor physical therapy as sometimes being more preventative or just even and education, because we do such a poor job of educating people about their anatomy and understanding it. I feel like I should just be giving referrals to pelvic PT to all of my patients. I do have a high referral rate, but I think we can, like you
Leave
said,
it.
having the time to look at your anatomy,
Yeah,
understand it, understand how it's all connected, and especially for women, pelvic floor, gynecologic organs, gastrointestinal organs, neurologic and musculoskeletal organs, they are all impacted when there is an issue with one of them.
absolutely. I mean, what I just showed you, I can't tell you how like long I've spent explaining that to people. They're like, why? Like it's on the outside. I'm like, it's all right there. Like,
Yeah, yeah, absolutely. I think that's so true. Well, I mean, I think, yes, a key takeaway from our colleagues that our pelvic floor PTs are our friends, are an extension of the care that we're providing. And I think too, as providers that get 15-minute visits and don't have time to go into detail, our pelvic floor physical therapist colleagues can not only just provide the education, but possibly even dig deeper and figure out what else is going on with our patients. So that's awesome. I know we're almost at time, and I want to make sure that we give an opportunity for the audience to ask any questions. Does anybody have any questions that they wanted to bring up or put in the chat? We've added some of the links.
yeah, thank you for doing that.
Oh, absolutely. And I will add intimate. I have an after visit summary with like my favorite lubes and products. I have Onut on there, but intimate
Oh,
rose
great.
and for sure the Sorola I will put
Yeah.
in. Well, wonderful. I thank you so much, Alex, for such a
Yeah.
thoughtful.
Thank you for having me.
Yeah, I think we covered a lot today, the basics of the pelvic floor, the mind-body connection, what visits look like, and practical pearls to bring back to our patients. We're excited to partner with Origin, and we're really excited about the work that you guys do and how much it interplays into the work that we do in mental health. So to everyone who joined today, we hope that you found these 45 minutes engaging and informative. I'm sorry if I took you on a journey trying to understand the ONUT a little bit better for myself. But just a reminder that Origin is a national leader in pelvic floor and women's health physical therapy with virtual care in 50 states, in-person care in 18 clinics, 50 million covered lives, and over 5,000 referring providers. So they support full body needs for women and people with vaginal anatomy through every stage of life, destigmatizing the shame. If only we could have more sexual health therapists and pelvic floor physical therapists together. But destigmatizing the shame that still exists around the biggest milestones in women's lives and making pelvic floor therapy more accessible. So if you want to learn more or refer your patients, please visit theoriginway.com or email providers@theoriginway.com. And at Seven Starling, we're committed to providing the full spectrum of women's mental health care and would love to support you and your patients. We are now live in Missouri and New Jersey. With these launches, we are now proud to support providers and patients in 18 states. Our Medicaid expansion continues, and we're thrilled that now Seven Starling accepts Medicaid in Texas. So please check out our website at sevenstarling.com to learn more. If you like this webinar, please subscribe to our newsletter so we can keep you informed about future events. If you have any topics you want to talk about, please feel free to send me a message and let me know. So Alex, thank you so much for your time again today. And I might ping you on your email later on for more recommendations, but I'll check out the link too that Mackenzie put in the chat.
For sure. Thank you so much, everyone. Have a great night.
Take care, everyone. Bye.